Hello, everybody, and welcome to this session on behalf of the FORCE conference called In Our Voices, Asian American Experiences with Genetic Counseling for Hereditary Cancer. In this session, I've invited 3 other Asian American women to share their experiences with genetic counseling, with learning that they've inherited the BRCA mutation, and to share a little bit about their decisions and how they were informed over the past couple of years. We are so excited to be in partnership with our genetic counselor, Diane Smedco. If you haven't been able to tell already, I'm Liza Toulousen. I'm with my sisters, Mary and Grace, and we are so excited to share a little bit about how cultural influences have affected our experiences around hereditary cancer, cancer itself, BRCA, and the field of genetic counseling. So in just a moment, I'm going to have my fellow colleagues introduce themselves, tell you a little bit about what brought them to this panel, and then we'll go ahead and get started with some question and answer. So with that, I'd like to invite Mary Toulousen to give a little introduction. We'll go to Grace and then to Diane. Hi there, Mary.
Hi, Liza. Thank you. My name is Mary Toulousen Lakanlale, and I am currently an assistant professor of Asian Pacific Studies at Cal State Dominguez Hills in Los Angeles. And I'm really excited to talk to you today. I'm mainly here kind of sharing my experience as a cancer survivor. I had breast cancer at the age of 34. And I was diagnosed in Los Angeles, but eventually returned home to Massachusetts for treatment at Dana-Farber. My age-ish is I'm middle-aged, and I am a Filipino-American. I came here at the age of 4 and grew up in Boston.
Awesome. Thanks for joining us, Mary. I'll turn it over to Grace Toulousen for a brief introduction.
Hi, I'm Grace Toulousen, and I'm also middle-aged. I'm 49, and I'm also Filipino American. And in terms of my BRCA status, I am a previvor. After my sister Mary was diagnosed with breast cancer, that started the process for me to get genetic counseling, and I made some decisions from there, which I can talk more about later, but I'm a previvor.
Great, thanks so much. And joining us is Diane Smedco. Hi, Diane.
Hello, everyone. I'm Diane Smedco, genetic counselor. I'm a certified genetic counselor, and I currently work at the MGH Institute of Health Professions in the Boston area. And I'm an associate director. Prior to that, being involved in GC education, I was a cancer genetic counselor at Mass General Hospital in Boston.
Thanks so much, Diane. And folks, I'm Liza Toulousen. I am, I put in the questions for all the panelists to answer like age-ish, and I love we're like, middle-ish, age-ish. And so excited to be here. I am also a BRCA previvor. I had the great fortune of having my sisters understand that they had cancer and they make decisions about BRCA status. So I kind of came right after my sisters. I also had a bilateral prophylactic mastectomy and oophorectomy. And a lot of those decisions were informed by the research and the work that my siblings and my sisters had done as well. So we were very interested in offering this session because each of us have our individual stories about what it means to be in our field. We are also all educators. And so we were really thinking about what does it mean to provide some thoughtful education, particularly around hereditary cancer, through this act of storytelling. I'm sure you're going to be experiencing a lot of different sessions at FORCE where they take a very medical approach, and rooted in kind of critical theory, we thought it would be helpful to provide storytelling as a way for us to examine what it means to be Asian American for us and what it means for us to be engaged in the hereditary cancer community. We certainly have personal narrative about what it means to be Asian American, but I wanted to mention a study that just came out in May 2021 by Young, Mock, Stanley, Bass, Cho, and Tabor. And in there, it was one of the first articles that I found where they were really looking at the statistics of Asian Americans and genetic counseling. And so one of the things that they had really understood was that Asian Americans had been understudied in the literature on genetic and genomic services. And again, from this personal narrative, yeah, I got that. Like we definitely can relate from that perspective. And so this research team was looking to systematically identify, evaluate, and summarize findings from relevant qualitative and quantitative studies on genetic healthcare for Asian Americans. Probably no surprise. And again, I hope that folks write that citation and take a look at that really incredible article. They had searched 5 databases from 1990 to 2018, which returned over 8,500 records, and noticed that 47 met the criteria for them looking at Asian Americans and genetic counseling and testing. And the research team's results, again, I think for me really affirmed what me and my sisters and Diane have been talking about for a very long time, that one, Asian Americans are under-referred, but have a high uptake for genetic services. That actually made a lot of sense in my family as well. 2, that there were linguistic and communication challenges that were common, and Asian Americans expected a more directive genetic counseling. I'll tell some stories later about an Asian American support group that I belong to, of which number 2 feels very true in terms of that narrative. And number 3, you're here with my family, that Asian Americans' family members were involved in testing decisions, but communication of results and risk information to family members was lower than other racial groups. So when you think about the relevancy of our panel, one, we wanted to amplify Asian and Asian American voices in this narrative. And we also wanted to make sure that for those of you who are in the healthcare profession, genetic counseling, that you understand the impact of what it means for Asian Americans to have less access or more difficult challenges and barriers to engaging in genetic testing and counseling, and then also the follow-up. So a lot of this narrative is rooted in some of those findings here. So with that, I'm actually going to turn it over to both Diane and Grace and Mary to talk a little bit about what brought them to genetic counseling. Let's start with you, Diane, as a field and as a professional. What was interesting for you? What brought you to genetic counseling?
Thank you. So certainly I always had an interest in science for quite some time, and that was largely influenced by my parents, who both trained as biochemists and microbiology as well, respectively. So I think that interest was always there. And then having worked in human genetics research for a few years, I actually never heard of genetic counseling. And so that's definitely one of the common threads for many genetic counselors, is that we really don't hear about the profession and learn about it until very often in later years of undergraduate training or afterwards. So for me, it was afterwards. But what drew me was that the element of being able to bring humanism in my work and have more of a relational piece to my work. And I didn't really know I wanted to be a healthcare provider until I found that profession that could kind of really join those interests of genetics, genomics, and healthcare.
Great, thank you. And what about for Mary and Grace? I mean, clearly we're now talking about from the patient perspective. I too had never heard about genetic counseling. I think when the two of you talked about it, I was like, yeah, never. I don't even know what that is. What are we doing here? So Mary and Grace, can you talk a little bit about why you chose to pursue genetic counseling in these early stages of cancer and a precancer diagnosis?
I guess I should go first, since I kind of was the one that that had cancer, and as part of the treatment that I was going through at Dana-Farber, there were a whole host of things. I was involved in a study as well during my treatment, but then also someone came in, a genetic counselor, and explained it to me, and have you ever thought about doing this so that you can be informed and also inform the rest of your family that this is a possibility. They took some blood, and I went through the tests, and I found out that I was BRCA1, and that other members of my family were as well, my extended family. So some of my first cousins also had BRCA. And so that's how I was introduced to it. And I believe, it's hard to remember, honestly, during that time, so many things were happening. It was quite traumatic. I was just like, yeah, just go ahead, do what you have to do. And so, well, once, everything was explained to me, and that perhaps I should invite my family members, especially the women, to go through genetic testing as well. I think then that kind of started the cycle, or started the process of finding out more about, what was happening to me, why. I guess, while not all women that have cancer actually have the gene, I just had to know, like, why did this happen? Why to me while I was 34? And I guess, it doesn't provide all the answers, but to know that it is something that was in the family, that was handed down in the family, but could also be a way for us to protect, the future generations by giving them the information that this is a possibility, and to watch out for it. So yeah, that's how I came into this.
Yeah, thanks so much. And as Mary mentioned, there was a lot that was happening in her life at the time. And so I have to admit, my sister Grace was the one who had followed up on a lot of the GC research, had found Diane, and was really the one that was like, everybody's getting tested. Everybody's just doing it. So Grace, can you talk a little bit about your first experiences with genetic counseling and what that push was for you to make sure that our family was tested?
Well, I think what I appreciate about genetic counseling is this very thoughtful, careful approach that I've experienced. I've only had lucky enough to have Diane as my GC. And, what I appreciated was that Diane was educating me about the process, but also giving me the ability to feel like I had agency and could consent at every level. Like, I didn't have to go through and get tested. That was very clear to me. So to know that she was going to tell me about this process and things that might come up, but it is ultimately my decision to test or not. That was very important to me. And I think that did help me feel more in control and want to pursue the process further, because I felt like I was in the driver's seat. And I think that kind of attitude I see throughout. I think that's part of what is prioritized here, is that you educate folks and then they decide. And I think this is where storytelling comes back in, as you mentioned earlier, Liza, because I think that within families, for us to talk about, like, this is what my experience was with genetic counseling. Like, you might think you only need to do it if you're about to have a high-risk pregnancy, but that's not actually what it's for. There's ways that it can help us make informed decisions. And just by making the call, it doesn't mean that you're giving your blood or your DNA yet. Like, there's this process that you can go through. And so I think having people understand that, so that they weren't feeling afraid to begin the process, was very important. And so telling those stories, and our generation, in my particular family, we're the first generation where we have the benefit of genetic counseling and the option to have these interventions and surgeries if we want. But that means that the young people, the children in our family, did not grow up watching the women, or mostly, go through the treatments for cancer. And so there's a story that doesn't get told there, because they're not, thankfully, right? But we have to continue a story, and hopefully they continue that story too, about why it is important to consider looking at, having genetic counseling if they decide to, when they turn 18, or whatever the protocols are, if they decide to have children, and so on. So there is a way that lowering the barriers and any kind of fear or bias that people might have towards talking about, very private issues. I think it's really important, because privacy is very important, keeping things within the family, keeping things to yourself, and that does not help us with hereditary mutations.
Right. Thanks so much, Grace. And also mention, Grace is a writer. Mary and Grace are both writers as well. Diane is also a storyteller. And so I'm grateful for a book that Grace had published called The Body Papers, which was essentially taking a lot of those private secrets that are held in families, for us, it was also that hereditary cancer piece and really putting it out there and seeing what the impact is. And I want to acknowledge that for some, not all, Asian American cultural communities, that privacy is really a cultural value. And so I'm grateful for the ways in which Grace, in many ways, put that out there to create some connections to see, so that others can see Asian American voices having this conversation. For those of you who are logged onto this presentation, you might be noticing that we're 13 minutes in and we haven't really talked about the Asian American piece yet. And I want to be transparent about why we spent the first half not diving into Asian American issues, because we also wanted you to see that Asian Americans also have the same conversations that non-Asian American communities are having about family and healthcare and decisions and choices. And so we wanted to really set that up to see that there's some common connectivity. You just might not have had access to seeing a screen like this, having this conversation. And so we are going to switch to talk a little bit more explicitly about the experiences of identifying as Asian American and engaging in hereditary cancer and genetic counseling. And I'll start just by saying that I have very clear ways in which my Asian American identity has informed and impacted my approaches to BRCA and to talking so publicly about this work in a couple of ways. While my sister Mary mentioned that there was a lot going on during the time when she had been diagnosed, similar things were happening in my family too. My toddler had just finished up her last cancer treatment when Mary discovered that she had cancer. So talk about being like, I don't know what's going on. Like, I'll just follow anybody's lead. Like, I'm really lost at this point. And so I felt like, to connect to Grace's point, there was a lot of things about my toddler's cancer diagnosis that didn't have choice for me. A lot of things just happened and they were taken and we just went with it. And so when it came time for me, and this is where Diane plays a strong role, to have choice about what I could do, I realized that that was something that I was craving, was choice about my body, and by default, my toddler's body and my health. So I want to say, Diane, I do remember meeting with you, and I was, of course, getting all of my medical advice online, and everyone had very strong opinions about have the surgeries now, do all these things now. And other people would say, you don't need surgery at all, just do surveillance. And when you get cancer, you deal with it. And I'm so grateful for the ways in which Diane navigated that very small tightrope around, here's the information, and you have choice, and we're going to support you in whatever choice you decide to make. And for me, that was really rooted in my Asian American identity, because I didn't feel like I had choice in other places. Diane, in many ways, I talk about this researcher named Rudine Sims Bishop, and she talks a lot about windows and mirrors. And Diane was very much a mirror for me. And I mean a mirror as an Asian American woman, as a mother. And there was all these ways, Diane, in which you brought those identities into our counseling sessions. So for me, that Asian American connection and understanding, I believe, is the reason why I continued to follow up on my appointments, why I continued to engage in aggressive surveillance, because I'm not sure that I would have done that having just come from an experience where choice was taken away from me. So that's a very real example of how I believe my identity informed and impacted that. I'll say the other thing, that in 2006, when this was all happening for us, I didn't see a lot of Asian American representation in the cancer community and in the hereditary cancer community. And so I sought out support groups that were built for Asian Americans. I'm grateful for the work of Chen Chi here in Boston, who has done a lot with the Asian American women's community. And so for those of you who are counselors or healthcare professionals, creating some affinity group for Asian American women in particular, or Asian Americans with hereditary cancer, I think would be an important next step if you're looking to improve some of your practice. Mary, I'm curious to hear from you as a cancer survivor. Are there ways in which you noticed your Asian American identity or influences informing and impacting some of your cancer experiences?
Yeah, I think that I was expecting, I mean, I grew up in Boston. I'm a teeny bit older than you. So I think that there were more groups and more attention and more sensitivity to Asian Americans a little bit later for you. But for me, I already expected that people, healthcare workers, not all of them, of course, but most of them would not attend to that particular part of my identity. And so it was a bit isolating. As I said, I was kind of used to that isolation and that the ways in which that, you know, nothing was targeted specifically towards me as an Asian American. I think there's definitely important ways that should be handled. For example, were the drugs that were given to me attending to my particular identity? I don't even know. Are there ways that those drugs affect me differently than the vast majority of people that they were tested on, for example? So those are concerns, I think, that on that end that should be attended to. However, I would like to emphasize that Asian Americans are definitely different, not just by ethnicity, but social class and education. We are incredibly lucky. Both of our parents are physicians, and all of us are well, educated. And so I think for us, that particular part of our identity, the education and our upbringing, really allowed us to pursue the medical aspect of this, to pursue all of the options that were available to us. I could imagine, though, perhaps that someone who may not have our same background might be more wary of things like genetic counseling and prophylactic measures to protect you from cancer. So I think there has to be a lot of sensitivity, not just for the person's ethnicity or country of origin or their culture, but definitely in terms of social class and education as well.
Right. Thank you. Yeah. And I'm reminded, of course, that Asian Americans are not a monolithic group. So when we think about the intersections of race, class, immigration, religion and faith traditions, ability, like all those different things, as folks who are watching this are thinking about providing greater cultural services to Asian and Asian American populations, it's a very diverse range of experiences that you're addressing. And so, Guy, that leads me to my question for you. I'm always smiling when I ask you this because I know that it was your work as a genetic counselor, as a teacher and faculty member and administrator, and now a DEI professional, diversity, equity, inclusion professional that brought us together. So I'd like if you could take a moment, Diane, to talk a little bit about how cultural relevancy plays a role in all of those different positions that you had, specifically around genetic counseling as a professional.
Thank you. I think there's some elements that what Mary shared and what everybody has shared here that really resonate with me. And I think part of the reason why is that in a lot of ways we get used to being the other. I am Chinese American, I grew up in Canada, moved here when I was 12. And so it was a continual feeling of knowing that I have my culture from my parents' background as Chinese immigrants from Hong Kong and via China, but also that, I'm North American and I'm in a predominantly white space, both from education all the way to just the social influences and media, right? So not really having those mirrors throughout life also meant for me that being in tune with the questions and the why behind decision making for patients is not a far leap for me, because I think that cultural humility piece is more smoothly baked in when you already know, can understand what it might be to go to a provider or even come to a professor and just feel like, I don't really deserve to be here. Maybe they won't understand my questions. Maybe they won't really care. So that is like a huge, I think, step in bridging any kind of communication or informational gap between a provider and a client or patient, or student as well. So I think that's one way in which my Asian American identity has informed my care. I think the other piece is, and you brought this up already in terms of genomic studies, that's a huge gap. That is an enormous gap. And I think a lot of it can be influenced by unconscious bias, the stereotype of Asian Americans, not necessarily being both as the model minority myth, but also seen as a monolith, and even just the tradition of Western medicine that, what works for folks who are recruited in research is going to apply to everybody. So we have that legacy in genetics and genomics to attend to. And part of that legacy is huge gaps in our ability to interpret genetic and genomic information for Asian Americans, Hispanic populations, and African American and indigenous populations as well. So with that, that informs, I think, my work in GC education, in DEI, and my involvement on the levels of other program directors as well, in terms of what can we do to make sure that we don't stay persistently heteronormative and cisgendered and persistently incapable of really understanding and having evidence-informed understanding of what are the needs of the patients that we serve. So, so participatory research really has to involve the populations that we are saying we want to serve. And that has not always happened. So just adding to what you shared already about that.
Yeah, thanks so much. Again, you're bringing in such good pieces about equity. What are the barriers? What are the practices, policies, traditions of the field that have left people out? I'm connecting some of Mary's words to, well, I'm always used to just being left out. I'm used to Asian Americans not being talked about. So for those of you who are watching this short webinar, thinking like, how have I been playing a part in either the erasure or the invisibility or the silencing of Asian American voices in genetic counseling and in these experiences? So Grace, I'll turn to you. I mean, you also wear multiple hats as a writer, professor, advisor to a lot of different Asian American students and clubs, and also a previvor yourself. Can you share a little bit about how cultural relevancy shows up in your work or in your healthcare and in what that experience looks like for you?
Sure. I think having providers who are sensitive and thoughtful and paying attention, I think, that would help a lot. I mean, for me, like, I think what intersected with even just like sitting and going through that chart with, I remember sitting down and going through making the circles and the triangles and the squares and whatever, like even that, like, I felt really anxious about, because in my upbringing, whether it's because I'm an immigrant or because of my parents' trauma from coming from a dictatorship, like we do not want to write things down and we don't want to tell things about our family. And so there's ways I think that we need reassurance that there's nothing to be afraid of. This is not going to be reported to anybody. This is just in your folder. And so it might not be things that people think about, but like a lot of people bring trauma baggage with them and they don't want to be pinned down on paper. And that, at least that's my experience. And I'm thinking maybe that's some of the fear around not participating in some of these studies and things like that.
Yeah, thanks so much for bringing that up. And I also think about how the interpretation by professionals, when, let's use our example, when we as an Asian American family and as individuals were hesitant about filling out the chart, ours was coming from a place of trauma, and someone else can read that as being, they don't know about their family, or this is something that they're not open about talking about this. Well, so as I think about, Guy, we did this with a lot of your GC students, what are the assumptions that we make as providers and clinicians about people's experiences and answers, and how do we create greater pathways for that too? That's where I see that nice connection. What about for you, Mary? I know we're getting close to our time. How do you think cultural relevancy plays a role in your experiences, that you've had many, with healthcare providers, practitioners, and in your post-cancer experiences?
Yeah, I mean, I'm really grateful to especially a lot of the nurses who were really sensitive to my issues as a person. But yeah, there could have been more sensitivity to my experience as an Asian American. And I'm not saying I know how to do this. On the one hand, you don't want to think that all Asian Americans are the same. On the other hand, as part of that, you don't want to, be condescending in some way by assuming that they can't speak up for themselves. So ultimately, while you should take in as much information as you can about cultural sensitivity and relevancy, you ultimately have to treat that person as an individual that is coming from like an enormous complexity of background, whether it's education, class, culture, immigration experience, and so on. I know that's a lot to put on the shoulders of our healthcare professionals, but that one-on-one personal connection, I think, is what kind of got me through and made me brave about all the choices that I had to make. I mean, in that fog of getting cancer treatment, it was really, I felt like so helpless and like such a victim. And it's just at one point, I'm just like, okay, just somebody like help me. I can't even understand what's going on right now. And providing someone of a shared background might be a way to help, an individual that's struggling. But yeah, I guess that's all I have. Thanks.
Yeah, that's really helpful. And again, I think in a 30-minute webinar and even in the 2 years of courses that you teach, Diane, we can't cover all of the different ethnic identities and relativities. And in fact, when I was a guest speaker in one of Diane's class, I showed this nursing textbook that had been approved and it was published, this was a few years ago, that had sections about different ethnicities and their pain tolerances. And folks, I'm here to tell you, it was highly problematic. It got pulled from the shelves, though I think you can still find images of it online. And I think it was an attempt, kind of to what Mary's saying, for practitioners and educators to put something out there. But of course, it really backfired. It really played into stereotypes. So I'm going to ask everybody in just a moment to share maybe one word of advice or wisdom. And I'll get us started. I'll buy you some time because I have 2 quick ones that I'm going to put in there. One, I would say to GC healthcare practitioners, and certainly anyone who's a patient or caregiver who's on here, I think really amplifying the complexity of people is going to be important. And at the same time, there are cultural experiences. So I'll share mine. When I was in this, I was meeting with a counselor after the BRCA diagnosis, and they were trying to give me dietary tips. And one of the dietary tips is you need to cut out all rice. And I was like, I'm Asian. Like, that is really challenging. I get where you're going, but what else can we do, right? So when I think about this value in my culture as a Filipino about rice and diet, it felt like this very off culture moment where I was like, yeah, that's like literally what I eat 4 times a day. I get it. So as one of my words of advice is just be open to possibilities, understand that people are complex. And that also means doing a little bit of reading and understanding about different aspects of culture, cultural identities, and backgrounds. So let's actually go Mary, Grace, and Diane. What is like one short piece of advice or wisdom that you'd give to those watching this webinar right now? Let's start with Mary.
Yeah, I think that that if someone's not responding or perhaps is struggling, you can hopefully find someone that is of their shared identity that might understand more about their experience to come talk to them. But Liza, I just want to comment on that because it shows like where it does backfire if you don't maybe know enough. So on the one hand, their reference to rice might have to try to be inclusive of your Asian identity, but then again, it backfired because it just came out a little bit stereotypical. But so, those interrogating those moments where like, how much is like too much of like trying to be inclusive and in what way. But yeah, I had a team of support, which was the greatest asset to my recovery and treatment. And so I know it's not possible for everybody, but that's what I would recommend, finding that community to help you get through.
Great, thanks, Mary. Let's go to Grace. What's one piece of advice or wisdom you'd leave for people watching this webinar?
I think it's to ask yourself, like, what story am I not hearing, or what question, like what story is being left out? I mean, it's hard to know what you don't know, but you can ask the person across from you that question. Is there something that we haven't covered, or something that I haven't asked that you think would be important for you to share with me? It could be anything.
Great, thank you. What do you think, Diane? What's a piece of advice or word of encouragement for folks?
Yeah, I love the open-ended question that Grace posed. And to just add on to that is like staying curious really helps guide you so that you can ask yourself, what assumptions am I making here? And that deep listening. So it really ties into the storytelling. If you're eliciting stories, you're also listening deeply, and you are going to build connections there with your patients. And for the patients who are listening to this webinar, I'm hoping that elements of our webinar today really are resonating with you, because I think families are families, and your family may have genetic relationship, your family may have different connections. They may be your found family or chosen family, but somewhere out there you have someone who's supporting you, and you know, being able to kind of lean on each other a little bit can be really helpful, and reaching out for genetic counseling and or counseling support when needed is important as well.
Great, thank you so much. And for the genetic counselors who are watching, Diane might look familiar. She was the National Society of Genetic Counselors National Code Talker recipient, which is identifies a practitioner who focuses on issues of culture and diversity, inclusion, equity, and justice. I want to thank the FORCE Conference and the FORCE Committee for inviting us to engage in this webinar, to all of you for logging on, for my sister, Mary Toulousen Lakanlale, my sister, Grace Toulousen, and our favorite genetic counselor ever, Diane Smedco. I'm Liza Toulousen, everybody. Thank you so much for joining us. Stay healthy. Bye-bye.